We want to bring you another expert perspective on all of this. How fortunate to have Dr. Isaac Bogoch just in time, an infectious disease specialist at Toronto General Hospital. He is in Toronto, very much on duty this morning, as we can see. Dr. Bogoch, great to have you with us this morning. We've had a lot of words used to describe this situation in New Brunswick. Disappointing was one word that a doctor in that province used. Just give me your sense of all of this. A doctor who traveled out of province. The border is closed in New Brunswick between New Brunswick and Quebec, comes back into Quebec, chooses not to self-isolate, not to quarantine for those 14 days, and now an outbreak that could be a very major outbreak. Your reaction?
Yeah, it's certainly a very irresponsible move. There are rules there for a reason. There's public health restrictions for a reason. Certainly someone who works in a hospital knows that they're in touch with probably the most vulnerable group around. I mean, people are in hospital for a reason. There's a lot of sick people here who, if they do contract COVID-19 infection, are going to have a more serious outcome. Also, we're in touch with so many people every day, both patients and, of course, in our day-to-day life. And I would not be surprised, as many others have said, that there may be more people infected by this one individual. So it's clearly disappointing. And of course, it delays reopening the economy. It impacts not just the exposed individuals, but the entire community and the entire province. So it's clearly a tough situation.
Well, it really is. And as I mentioned, and I don't know whether you want to go down this road, but I'm just curious. As they've said, the RCMP is investigating potential charges. Could that be appropriate? Might it be appropriate in your view?
Honestly, I don't know. I really am not sure about to what extent this can take a legal path. But certainly from a health perspective, you can imagine that one person can cause such a tremendous impact in a hospital and in a community. When we actually think about moving forward, unfortunately, this is not going to be an uncommon situation. This is a very patchy infection. I appreciate that this is a very extreme example because someone wasn't obeying the rules and didn't self-isolate after travel and clearly went to work in a hospital. But if we sort of take a step back and think about general principles, we know with this type of infection, there's probably a small percentage, probably 10 to 20 of the individuals with this infection are likely responsible for about 80 to 90% of subsequent infections. These are people who are just shedding more virus for a longer period of time who can infect more people. We've heard of terms called super spreading events. This is likely one of them. And we've seen this happen in Alberta. We've seen this happen in other parts of Canada and, of course, in other parts of the world. This is what we're going to see moving forward. Even after this infection is under control in much of the country, we're going to see patchy pocket outbreaks, and it's likely related to super spreading events. And in the pre-vaccine era, this is what we have to get used to, and we have to be able to rapidly identify them and quell these outbreaks before they spread to much larger outbreaks.
Which is exactly what the province is doing, sending in testing to that particular part of the province to sort of flood the zone, if you will, to see how widespread this is. But it is a good reminder, is it not? I mean, this is a province that really did have a very good handle on things and was poised even as early as today to open up further. And yet you see when you don't follow the guidelines, just what disruption can result, as you've just indicated there.
Yeah, absolutely. I mean, New Brunswick was doing fantastic. They were having 0 to 1 new cases per day. They had a period of time when they had, I think it was a few days in a row where they had no new cases per day. They were ready to open up. And then you have an event here where there's now 6 positive cases. And, some people might say, oh, there's only 6 cases. But we have to remember, this is in a small town. There's a lot of close contacts. And now public health is swooping in to really find as many people as possible that were potentially exposed and identify them and isolate them. That takes a ton of work. There was a very similar event actually in Korea with someone who went to a nightclub who had symptoms. There was a ton of close contacts. There were over 100 people infected from that one individual. And we saw New Brunswick is taking a page out of the South Korea book, which is fantastic. Swoop in, test as many people as you can, do rapid contact tracing, rapid identification and isolation of close contacts and positive cases, and you can really quell this quickly. So this is the right move, but of course it takes a lot of human power and time and energy to do it, and you need the public health resources to do it.